This is the first time in history that I know that the Surgeon General and the Assistant Surgeon General have come down to our part of the country to hear the challenges that we're faced with from the medical community and all the support groups in that medical community. I was impressed. They wanted to hear what the challenges were so they can respond and provide information that's meaningful to the physicians, to the hospitals, and to those care providers in our community.
The Surgeon General's office gave us a call and they asked for Terrebonne General to host them to come down to talk about our community issues related to the oil spill. We have a lot of healthcare providers in our community and other communities within Region 3, and she wanted to hear exactly what was going on so we could provide the best care or the resources for our community to give them the care related to the spill. This is the first time the Surgeon General has ever come to Houma, Louisiana, and I think with her entourage and her wonderful colleagues to take an interest and to come to our rural area to look at what this has been or what this has done for our community, I think shows an interest, and we respect her immensely for that.
It's the first time the Surgeon General's come to Terrebonne Parish and to this facility, and for the healthcare community in Houma and the surrounding area to be able to have an audience and a voice with someone that has a president's ear on things that are near and dear to our hearts and things that are specific to our lifestyles and our homes and our communities, I think is huge, and to have that opportunity is huge.
We from the federal government are here, and that we really want to be able to be of service and to make sure that we're available to be of any help that we can, and that we're willing to do what we can to help. And that's really why I'm here. People don't, from this area, as I know because I am, we don't like to ask for help. So I want to offer help so that people don't have to ask, but we are available.
I'm excited that the Surgeon General has come and her assistants and her staff to hear the challenges, and they, I believe, will respond to those challenges. In this whole challenge that we know is this oil spill, what I've seen is a great coordination and collaboration between the government, the healthcare agencies, and the consumers of healthcare to be able to solve problems. And that's what we're here to do, is solve problems. That's what Terrebonne General is all about, is curing people and solving the challenges that they have. This just continues to show our leadership in that area of solving problems.
I think what I personally discovered is, of course, we always have excellent healthcare providers within our community and with all the subsequent communities that are adjacent to us. But I do think that they're taking an interest to assure not only are we going to maintain the healthcare needs for today, but what may come up for tomorrow. And they are extremely concerned to make sure that we stay healthy, not again just for today and the things they're seeing today, but what if something arises 6 years from now?
It was really wonderful to be here with local physicians, local clinicians, and hospital administrators to talk about the effects that the oil spill has had on patients, particularly emotionally and psychologically, the behavioral health issues. We've been through so much in this area. We know that people react to life-altering events in various ways. Some people will, get a little angry, they'll get sad, and they'll roll up their sleeves and they'll bounce back. But there are other people who will become very depressed. They will turn to alcohol and substance abuse, and sometimes they'll think about harming themselves or others. And those are the people that we really are concerned about, that we make sure that they know that services are available. And we know that the clinicians, like the ones here, are prepared to take care of them. And the things that we're seeing is they may be as subtle as one lady that I talked to who said she went in her kitchen to make her gumbo, and she didn't have the things the ingredients, and she just started crying. So those sort of emotional effects are hard to explain to people, but they really are real, and how important the behavioral effects of the oil spill are from a health standpoint.
There are many issues that are undiscovered. We do have dispersants, we do have heat exhaustion, we have the mixture of the heat with the dispersants and the oil, we have mental health issues, we have the depression issues related to the moratorium and out of work, and there's so many other things that we just haven't even had the opportunity to investigate totally.
Look after your neighbors that oftentimes when you're feeling sad and feeling often depressed and things, you may not seek help for yourself. So look for your neighbors and see if you can help them, and just look out for each other.
I hope an integration between the federal agencies, the Surgeon General's office, and our local providers occurs. Information will flow more freely, and hopefully we'll get providers down here. The mental health corps may come down to help support, to give the doctors, to give the emergency rooms somewhere to be able to recommend people to get that care that they need. A lot of the challenges, as we heard tonight, are not necessarily physically going to be challenged, but people are going to be mentally challenged. Stress, alcoholism, things that will portray themselves. They may portray themselves physically, but it's as a result of the stress and the depression that people are feeling as a result of what's going on in our community today. So hopefully the integration of Washington along with the state, along with the local people, will help us to be able to get those tools that the doctors need to be able to really bow up our community, because right now there are cracks and people are going to fall through those cracks. This will help us, I hope, to go directly to the top, if you would, to get that support, and they'll be able to send it down here for our physicians and our hospital providers.